Hi, everybody. This is Michael King, and I am joined here with our surgeon, Dr. Gina Cottle, here at Lake Austin Eye. And we are excited to go through the top 10 questions about LASIK. So if you're watching this video, chances are you've been thinking about the procedure, but you may have some questions. And what we wanted to do for you is answer all the questions for you so that way you're better prepared to be able to find out whether or not LASIK is right for you. So Dr. Cottle, before we get started, anything you'd like to say?
No, it's great to be here with you. Thank you, Michael. And I'm glad to be here talking to everyone about LASIK, and hopefully we can answer some questions.
Excellent. So the first question is definitely one of the biggest questions we get here at our practice about laser vision correction. Is LASIK safe? So Dr. Cottle, when a patient comes up to you and asks you that question, how do you respond to that?
LASIK is actually one of the safest procedures that you can have these days. The way the technology has advanced, there's very little that can go wrong. And luckily, if there were to be a minor complication, I happen to be a cornea specialist. And so if there's anything minor that happens, we can usually take care of it right away. But overall, I usually quote, it's less than 0.1% chance of anything happening that you wouldn't want.
Excellent. Now, along with the previous question, which is talking about the safety of LASIK, another question that patients have is, does LASIK hurt? It's a very natural question to ask as you're thinking about this procedure, having a laser near your eye. So when somebody asks you this question, how do you help them deal with, how do you answer that question for them?
Well, first of all, when you come into the LASIK suite, we help you relax. We make sure that your eyes are completely comfortable. We give you a little sedative to help kind of take the edge of anxiety off. And then you do have numbing drops for the procedure that take away the pain completely. And so there really is no pain associated. There's a little bit of pressure at times, but nothing that hurts or makes you want to squeeze or anything. So I think that makes patients feel a lot more comfortable about the procedure when they realize there aren't going to be any surprises.
Anything you'd like to add about what happens? So, they have the procedure done and then they're going home. What can they expect in, the first few hours after the procedure as far as any discomfort?
Sure. We tell people to do expect a little bit of tearing, a little bit of foreign body sensation as if your eyes are really dry. We usually tell people just to go home and close their eyes, maybe take a nap. Obviously, you're going to be putting some eye drops in that will help with any discomfort as well. But it's really pretty easy to get through even the first 24 hours.
Excellent. Our next question in our top 10 questions about LASIK is regarding the side effects from LASIK. So obviously this is something that people want to have an answer to. So are there any side effects from LASIK that a potential patient needs to be concerned about?
We still talk to people about the possibility of having halos or glare in your vision at nighttime, especially from LASIK, just because of the optical dynamics on the cornea. But nowadays, again, that has really lessened, and we are very excited that we have the newest technology here at Lake Austin Eye. We offer Contura vision correction, which oftentimes gets rid of many of the higher order aberrations, we call them, in your eyes, that if you even had halos before LASIK, those might actually improve after the treatment because those little micro changes in your eyes are actually fixed with Contura treatment.
Excellent. Our next question is a very common, it's a misconception that a lot of people have in laser vision correction as they're going through the research of, can LASIK treat astigmatism? And first, I guess this is a two-part question where, first of all, what is astigmatism? And then I guess the other part is to answer the question, can LASIK treat astigmatism?
Yeah, astigmatism is everyone kind of knows the word, but they don't really know what it involves with the eye. And the way I explain it in simple terms is that it's just the cornea, which is the part of the eye, like the window of the eye, that's where you have the LASIK performed. The cornea is shaped more oval or more like a football rather than a circle or a sphere. And so it's steeper in one axis than the other. And yet, yes, LASIK can absolutely treat astigmatism these days. And again, with the added technology that we have now with our wavelight and Contura treatments, we can treat even higher levels of astigmatism than we could before.
Excellent. And this next question is one that everybody wants to know, which is how much does LASIK cost? And so as you're going through your journey and you're kind of doing a bit of research and you see, pricing everything from LASIK 220 or 495 an eye to, it's a little bit confusing to some people. And so a couple of things I wanted to mention is, number one, that type of pricing is really kind of a teaser price to get you to call that specific practice. We don't offer that here at Lake Austin Eye. We're very transparent when it comes to our pricing. And so, if you're looking at the national average for laser vision correction, here in 2019, it's between, I'd say, $2,300 to $2,600 per eye. We're right along the national average, but what we do offer is phenomenal financing options, 0 down, 0% through Care Credit, that allows you to be able to afford laser vision correction at very low monthly payments as well. So when you come into our practice for your initial consultation, we'll be able to go through and again, transparently lay out for you exactly what's covered with respect to the pricing for the procedure so that you're well prepared to know and kind of get everything in order before the big day. And our next question about the top 10 questions about LASIK is the recovery time. So for somebody who's having this procedure done, Dr. Cottle, and how much time do they need to take off of work and what's the recovery time and what can they expect?
Most people can go back to work the next day after LASIK. We like to see you the next morning to make sure everything's in order and everything that you had a good night. But a lot of people can return to work that next afternoon if you want, as long as you're using your eye drops. Recovery time total, you get better each day, but a lot of people can drive themselves the very next day because their vision is so much better. So we usually say, no swimming for 3 weeks, no strenuous sports for probably 4 to 5 days. But in terms of returning to work or everyday activities like going out to dinner, you can do that pretty much the next day.
Awesome. Now, in our next question here, we're going to talk about the difference between LASIK and PRK. So for those that maybe not know the difference or what these procedures are, how do you address that question to a prospective patient? And why would we choose one procedure versus the other?
Sure. Well, the biggest difference is with LASIK, there's an actual flap created in your cornea. The laser creates a flap that is reflected back, and then the laser is performed to reshape the cornea under the flap, and then it's put back, and that's LASIK. PRK, the laser is used to reshape the cornea after the surface cells are removed, and so those surface cells then grow back. So the end result is the same with LASIK and PRK. LASIK is a little more comfortable because you don't have all the additional healing that PRK can have, but in the end, the end product of the same vision expectations are the same. The reason why we would sometimes recommend PRK over LASIK is if a person has a thinner cornea and we might want to leave more corneal tissue in place and only let the laser ablate the tissue at the surface and not create a flap and then ablate it. And so sometimes we consider that it might be a better idea for people just to have the PRK and not have a flap created. But in general, I tell everyone that the results are about the same.
Yeah, and really, this is not something that you need to figure out prior to coming in and finding out if you're a candidate. Dr. Cottle and our team will be able to do all the measurements, and then at the actual consultation, we'll be able to kind of let you know the different options that are available to you.
Yeah, that's correct.
And our next question, for those of you that are past the age of 40 and you're wondering kind of what's going on with my reading vision and can LASIK actually correct my reading vision? Dr. Cottle, for those types of patients who are past that age of 40, how do you address this question to them?
Well, there's a couple different ways to approach this problem. One way is if you want LASIK correction, you can still have that done, and you can have what's done called monovision, where your dominant eye is corrected for distance vision, and then your non-dominant eye would be corrected for your reading vision. And so your brain kind of takes over and uses your dominant eye to distance and your non-dominant eye to read. And that's called monovision, which we've done for years. Another way that you can have that corrected is something called a clear lens exchange or refractive lensectomy. And we do a lot of this these days. That's essentially removing the natural lens in your eye and replacing it with a lens implant. And that lens implant is a multifocal implant that corrects distance, intermediate, and near. And so both eyes in that situation are corrected for distance and near vision. And sometimes that's actually a better option than doing the monovision LASIK, depending on the person, really.
Yeah, and really, if you're wondering which option is best for you when you come in for your consultation, Dr. Cottle and our team will be able to kind of just help you understand the different options that are available and how they can fit into your lifestyle.
That's right. And that's the great thing about our practice too, is that we are cornea trained and we offer all the procedures and technology that is out there. And so if we see you for consultation and decide you might be a better candidate for a different procedure, the great thing is that we do offer a wide array of these procedures to recommend to you.
Excellent. For those patients that are wondering about whether or not LASIK is permanent, so is LASIK permanent, and do they have to have it done multiple times? How do you answer this to a patient?
LASIK is considered permanent. The very rare occasions people might have to have what are called enhancements, where we add additional laser to fine-tune your distance vision. But the biggest reason why a lot of people come in and think their LASIK has worn off is because they aren't able to see up close anymore. And that's when we start to discuss either monovision correction by adjusting one eye for reading, or actually doing the clear lens exchange and using lenses inside the eye to improve their reading vision. But in whole, LASIK is considered a permanent procedure, and there's very little reason to do additional laser down the road unless it's for reading glasses, really.
Awesome. Now, on our last question, which is really if after you've watched all the different questions and you're really wondering in your mind, am I a candidate? So how does somebody find out if they are a candidate for this procedure? Then along with that, what makes us unique here at Lake Austin Eye, and why they should come to our practice for a consult versus another place here in Austin?
Sure. Well, oftentimes it just takes a phone call, and we have everyone, our staff here, that can talk to you about whether or not you might be a candidate. A lot can be gained over just a simple phone call. And then we'll have you usually come in for a free consultation where you will meet the surgeon, one of us, and you'll talk about whether or not you're a candidate for LASIK, or again, we might recommend a different procedure. But again, because we're cornea specialists, we're both surgeons, we are able to offer all the newest screening technology that there is. We screen for dry eye, we screen for all the eye diseases, and we can really make a best suggestion on what you're a good candidate for.
Excellent. So on behalf of all of us here at Lake Austin Eye, I just wanted to thank you all for your interest in laser vision correction, and we look forward to seeing you in our practice. Dr. Cottle, I'll give you the last word before we finish.
Thank you. Again, our motto here at Lake Austin Eye is your vision, your life. And we really believe that we make a difference in your life through improving your vision.
Excellent. Thank you, everybody. Have yourself a wonderful day. Bye-bye.